Hi guys, my name is Katie, and I'm going to talk to you about rhabdomyolysis. It's also noted as rhabdo for short within the medical field. You may ask me, what is rhabdomyolysis? Rhabdomyolysis is simply put as the breakdown of striated muscles within the body. According to the CDC, approximately 26,000 cases of rhabdomyolysis are reported annually within the United States. So some signs and symptoms that you're going to want to watch for when it comes to rhabdomyolysis are muscle cramps, aches, or pains that are more severe than expected, dark colored urines that are tea or cola colored, feeling weak or tired or like you're unable to complete a job task or finish workout routines. You may even experience seizures and nausea and vomiting. According to the CDC as well as the Cleveland Clinic, some people have no symptoms at all. They also stated that you will have an increased level of CK or CPK, which is creatine phosphokinase within the blood. CPK is a protein found within the blood when your muscles start to break down. So some causes of rhabdomyolysis are to include trauma injuries, crash injuries, or crush injuries that may happen either at work or in a car accident or things like that. The CDC did state that the use of drugs such as cocaine, amphetamines, statins, heroin, or even PCP can cause rhabdo. Genetic muscle diseases such as metabolic myopathies, muscular dystrophies, and chenopathies or conditions that are associated with exercise intolerance and exertional rhabdomyolysis. So some extreme changes in body temperature, ischemia, or death of muscle tissue, which is happening during the muscle dystrophies, low phosphate levels within the body, seizures or muscle tremors, severe exertion such as marathon running or calisthenics, lengthy surgical procedures, severe dehydration, and the use of steroids. So some results of having rhabdomyolysis include kidney disease, kidney failure, permanent disability, or even death. In the picture above, you are seeing a picture of a striated muscle and those enzymes that they are giving off as well as their myoglobin. This is going into the blood circulation, which they are causing edema and hypovolemia within the body, which is also producing a myoglobin cytotoxicity within the kidneys, which is causing the kidney failure for a lot of people. So you may ask me, who is affected by rhabdomyolysis? So the first to note is going to be endurance athletes. So endurance athletes include marathon runners and people who take spin classes. It also may include people who do high intensity interval exercises, so HIIT classes, as well as those calisthenics that I had mentioned previously. These groups push themselves too hard without resting. They don't give themselves time to recuperate from everything that is going on within their body while they are doing these exercises or while they are sprinting and things like that. Firefighters can also be affected. This happens after physical activity within high heat. Which is causing them to overheat. As you can see in the pictures above, these are firefighters from the recent California and Oregon fires. They were enduring high heat and the physical activity of carrying their hoses and everything for extended amounts of time without adequate hydration. Service members or active duty military members can also be affected by rhabdomyolysis. This for them is mostly during boot camp or the intense physical training. They also can experience that heat exhaustion from carrying all of their gear, their masks, wearing vests, just depending on where they are, what they are doing, and things like that. Older people can also be affected by rhabdomyolysis. This is due to the older people that do fall and they can't get up by themselves, people who aren't discovered for extended amounts of time after a fall. In my own experience, I did have an older woman come in after she had taken a tumble down the stairs. She said that she was laying there for about 45 minutes before her husband came home, and noticed that she was on the floor. She was just nowhere near a phone that was able to get her access to help. Um, she was tested for rhabdomyolysis and it did come back positive. She was having quite a few symptoms to include the dark colored urines and the muscle pains and everything like that. So, being diagnosed with rhabdomyolysis, this is going to be done through blood testing. According to the Cleveland Clinic, a healthcare provider can do a blood test for CK or that CPK. Now remember, CK is a muscle protein that is released into the blood when muscle tissue is damaged. When rhabdomyolysis is present, those CK levels will rise. Your healthcare provider would want to do repeat blood tests to determine if those CK levels are going up or if they're going down. Like the appearance of symptoms, the rise in CK levels may be delayed after a fall or a motorcycle accident, a car accident, or what may be it. Healthcare providers should also make sure when they do those repeat tests, they want to do at least 2 consecutive tests that show that those levels are lowering and showing that you are getting better. Now, when it comes to urine testing, urine dipsticks are not a very good way to diagnose rhabdomyolysis itself. These tests check for myoglobins indirectly. Myoglobin is a muscle cell component within the body. Myoglobin is quickly cleared from the body, so it may not be detected in the urine while those CK elevations are in the blood that have persisted for days. So this picture here is a picture of urine from a rhabdomyolysis patient. You can see it is that tea color, um, like I had talked about previously. So some treatments for rhabdomyolysis are to include your doctor may give you IV fluids and electrolytes intravenously. These IV fluids will help push those toxins out of your system. And in severe cases of rhabdomyolysis that cause kidney damage, you may even need dialysis. Dialysis extracts or removes some of your blood, takes out the toxins, and returns that filtered blood back into your body. You may also need to stay in the hospital for a few days depending on the severity that you had. And after that treatment, your doctor may send you to physical therapy to help you strengthen those muscles after that initial period of rest for your body to recuperate from everything that has been going on. So, how to avoid or help prevention of rhabdomyolysis? You may not be able to prevent it, especially if it's coming from a work-related accident or a car crash or something like that. But you can reduce your risk of developing the exercise-induced rhabdomyolysis. To lower the risk of getting rhabdomyolysis, you should start an exercise program slowly and listen to your body. If you feel sore or tired during a workout, make sure you stop and rest. Don't push yourself beyond those safe limits of your own body. We want to make sure that you stay hydrated and avoid overheating. Take breaks in the shade if you're doing physical activity outside in the heat, and that's especially important for all of us who live here in Arizona or in other high temperature climates because during the summer our temperatures rise up to 120 degrees, or it can. And you want to make sure that you're not abusing alcohol or taking illegal drugs. And those illegal drugs, like we talked about before, are the cocaine, the amphetamines, the PCP, the heroin, things like that. And you want to talk to your doctor about any medications that you are taking that may increase your risk of developing rhabdomyolysis. And you really want to be careful, especially if you have diabetes or liver disease. Like I had stated previously, the CDC had noted that statins that are used to help lower your cholesterol can cause your body to break down muscles and cause rhabdomyolysis. Thank you for listening to what I have to say about rhabdomyolysis. Here are a couple of the sites that I used to get my information. I used the CDC and the Cleveland Clinic. I also used Medline Plus Encyclopedia to get the definition of rhabdomyolysis. Thank you and have a great day.